Good morning and welcome again to those just joining us. We are landing here on this purpose of the learning collaborative. So I'll just share out while we welcome others and have others joining us. The purpose of the learning collaborative is to create and sustain a learning community that raises awareness and inspires personal and collective growth. These meaningful engagement opportunities aim to ignite participants to contribute to transforming systems that foster community wellness. So we are grateful to you all for joining us today, for engaging with this content, and we look forward to a robust dialogue following our presentations. My name is Danny LaForest, and I am the Workforce Development Liaison with Greater Health Now, and have the honor and privilege of helping facilitate these learning collaboratives. So I am very grateful to you all for being here today. And we will slowly get rolling here and just dig into the content or the topic for today. And our topic is supporting the workforce through change and uncertainty, innovative strategies and creative solutions.
I don't know.
Oh. Okay, and we're excited to discuss this topic and to share about some of the innovative solutions that Greater Health Now has been working on. You'll hear directly from our Greater Health Now team, and as well as our additional presenters who we're so grateful to have today. So these are our learning outcomes for today. By the end of today's session, you'll be able to recognize the benefit of clinical supervision models for workforce wellness, as well as be able to describe the development of Greater Health Now's resiliency support program. You'll be able to, from our second presentation, identify applicable coping skills for completing the body's stress cycle, and apply strategies to maintain a culture of support. So we will start today with Anna Sandage from Greater Health Now and Elena Brighton from Anchor Point Counseling. And in our second hour, we'll have Darcy Freeman from Darcy Freeman Coaching and Counseling. And with that, I will go ahead and introduce our first two presenters. Anna Sandage is the Senior Director of Transformational Health Integration at Greater Health Now. Prior to her joining the Greater Health Now team, Anna spent 20 years as an international human rights social worker and the last 10 years in nursing, working with patients and families in neonatal ICU, hospice, and HIV care. Anna relocated to the Pacific Northwest almost 3 years ago from the Midwest and returns often to spoil her two beautiful granddaughters. And Elena Britton has been working in the mental health field for the past 18 years, serving individuals and families in Benton and Walla Walla County. She spends her free time outdoors, hunting, fishing, and camping with her husband and two kids. So I will turn it over to you, Anna and Elena, and just let me know when to advance the slides.
Great, thank you. And Elena, just chime in when you feel like you've got things that you want to really lift out into this conversation. Thank you everyone for making time for us today. This is something I'm really passionate about. As you can tell, I've been doing this work for some time, and how we take care of professional caregivers is something that I find really, really important, especially in the work that we're doing with Greater Health Now as we're building capacity to provide care for our neighbors. So when we think about resiliency and support and how do we respond to compassion, fatigue, and moral injury, I think those are terms we hear a lot about, and we'll actually go into more detail about understanding what those are and their actual impact. But I imagine for a lot of you who are professional caregivers and go into caregiving professions, it's because it's something that's just really innate and deep to who you are as a human being, and you have a skill and a gift for that. And those very skills and gifts that call us to this work can sometimes be the things that make this work the most difficult for us. And so looking at the opportunity to provide compassion and support for our providers that are doing caregiving is essential to making sure that they can do their best work and move the work forward. So next slide. So a lot of times we like to talk about the terms of burnout and compassion fatigue and moral injury, and sometimes it's hard to tease all of those particular pieces out. And when we talk about terms of burnout, it's usually characterized as symptoms of emotional exhaustion, depersonalization, and just not feeling like we've accomplished what we want in the work that we're doing. And it's not unique to caregiving professions, but it certainly is prominent in caregiving professions, which makes it really hard. I was a nurse during COVID, and I'm sure a lot of you had service delivery experiences during COVID as well. And that was definitely a time when we started to really see the difference between burnout, compassion fatigue, and moral injury. And I don't know what your experiences of that were like, but pulling up to the hospital on a pretty regular basis, there were cardboard cutouts of nurses with capes, and the signs would always say, "Not all heroes wear capes." And I know that that was intended to kind of boost us up and bolster us, but what it really did is it kind of delineated the fact that we were supposed to be something greater and more, and it diminished our personal experiences of what it was really like to be giving care during these really difficult times. And so one of the things that looking at the difference between how we do superficial engagement versus really deep support of our caregivers and our service providers is kind of how we distinguish between moving away from accolades to really providing the professional support that's needed. Next slide. So terms that are used an awful lot in this work as we're really kind of deepening is understanding the difference between compassion fatigue and moral injury. Natalie Vaughn recently wrote in an article for nurse.com that compassion fatigue occurs when a person is physically, emotionally, and spiritually exhausted from caring for others. And this comes from either their own personal trauma or from the vicarious trauma that they're experiencing by giving the care and support and work. This also occurs for social workers, teachers, frontline workers, anybody who is in a caring profession. We are all at risk for this. And one of the components that can easily get lost is compassion means to suffer with. And that causes you to have to give a part of yourself into that work. And some people are really gifted and skilled and have developed tools and practices to create a healthy boundary so that they can accompany people in that type of really intensive caregiving. And others are really struggling to figure out how to create those boundaries and separations. And so that's why we really want to lean into the conversation around resiliency support, because that is an intentional way of giving caregivers the ability to have tools, skills, and practices that allow them to be compassionate and accompany those that they're serving without having to suffer from compassion fatigue or burnout. So another component of this, and I think this is something that really was lifted up during COVID, that made those signs about not all heroes wear capes feel a little abrasive, is this concept of moral injury. And moral injury occurs in caregivers and service providers when the circumstances in their environment are incredibly overwhelming. Maybe there's a lack of resources, maybe there is an inability to be able to meet all of the needs that are being presented, and the capacity just isn't available to address the concerns that you're seeing. And it really gets to the deep heart of who you see yourself as a professional caregiver. Next slide. And often when we experience that deep moral injury, it really kind of throws us into a professional crisis. Why am I doing this work? Am I even effective? Why am I sacrificing myself, my family, all of this for something that seems like an insurmountable goal? And we start to internalize our own ability to be professionally effective, and that has direct client impact and patient impact. And so, what does compassion fatigue and moral injury have to do with the community-based workforce? Well, they are our frontline workers. They are the individuals who are meeting our clients in person, on the phone, in the offices, firsthand, and they are walking and accompanying with those clients through some very difficult times. Often our community-based workforce comes with lived experience, and that is the gift and brilliance that they bring to this work. But so many of our community-based workers haven't been afforded the opportunity to have a lot of their lived experiences addressed through therapy, healing, trauma support. And so as they're in this work, they are also struggling with some of their own re-injury from their previous experiences, or they're taking on their client's injury and trauma from the work that they're doing in the accompaniment. This is work that when you're called to it, it's really sometimes hard to separate your personal experience from that of your client. And also for a lot of frontline workers, we don't provide them the level of engagement and training and support to really navigate those complex and difficult situations they find themselves in. One of my very first jobs at the age of 18 was working in a group home for developmentally disabled adults and individuals with severe psychological and psychiatric difficulties. I was 18, just barely came off orientation, haven't even been trained in all of the things that I'm supposed to be trained for to do this work and do it well. And I'm going to a group home to serve as a staff position for somebody who was currently in the hospital because a client resident had assaulted her and she was hospitalized for that. 3 days later, when she was discharged, she was working beside me, and no support, no processing, no therapeutic engagement, and no ability to really look at how that impacted her personally and how it impacted new people coming into this work. And it's just kind of this awakening for me of that we often don't recognize that the individuals who are in those entry-level caregiving positions are really the ones who have the most contact with their clients, but the least support and often the least training and the ability to provide the care that's needed to really serve our communities and serve them well. So next slide, please. So what is resiliency support? Resiliency support is modeled after the practice of clinical supervision for licensed professionals. As individuals get more training, as individuals get more education for licensure, we have models that allow for apprenticeships. We have models that allow for clinical supervision, for fellowships and practicums. But for those real basic entry-level caregiving opportunities, we don't have that same level of training support and wraparound services. But the type of clients that they're engaging really do have the same needs as those that when they get engaged in those higher licensure levels of care. So the goal of resiliency support is to take the practice of clinical supervision and apply it to community-based workers who are engaging in complex client care. It focuses on three main areas: normative, formative, and restorative. And I'm going to tap Elena to talk more about that. But what resiliency support is designed to do is to meet with those individuals who've gone through intensive training through our Camden Coalition Complex Care Certificate Program, through coaching with our workforce development specialist, and to really take those theories, practices, skills, and tools, and then with a licensed professional, understand how to incorporate that into their day-to-day work, but then also how to take care of themselves and understand when their individual experience might be bleeding into their practice and their work and impacting the care of their client. So I'm going to ask Elena if she wouldn't mind just sharing a little bit more about what clinical supervision looks like in the therapeutic setting and its purpose and role. And then we can talk a little bit more about how we would pull that into the work for resiliency support for our community-based workers.
Yeah, there's a reason why in our field, so I'm a social worker, I'm a clinical social worker, why in our field they require that we have clinical supervision. So in our field, we're required to have, I believe, 70 hours of supervision over 2 years. So it's pretty intensive. The purpose of the supervision is kind of just to highlight some of the things that Anna said. It's really to be able to build a workforce that's healthy and well enough to serve clients. With all of these impacts of moral injury, which happened, I was actually, as Anna was speaking, I was just dealing with during one of my clinical supervisions yesterday. I had a staff member who was coming to me who was very impacted by the fact that they weren't able to get one of their clients a higher level of care. This was the perfect example of moral injury that was occurring for this person. She desperately wanted to be able to find care for her client that was at a higher level than she could offer, and there just was nothing available. This over time can erode therapists and any community-based worker. It can erode us into becoming cynical. It can erode us into becoming burned out from our jobs, which then does really impact patient care. So one of the biggest purposes, there's two reasons in my mind why we do clinical supervision. Number one is so that we're doing the best service to our patients, and number two is for to maintain a workforce that's healthy and well. So during clinical supervision, some of the things that occur, we try to always fit our supervisors with the need of the supervisees. So if there's a special population, for example, that's needing to be overseen by a supervisor, will ensure that the supervisor that's chosen for them understands their niche or understands what the indications of their job are. So the first biggest part of building supervision is just building that relationship, that trusting relationship. It's kind of an interesting relationship where it has some tendrils that feel like therapy. It has some tendrils that feel like maybe like HR support. It's got some tendrils that feel like that normal supervisory relationship where someone is really helping guide your decision making, some coaching feelings. So the biggest thing that I think is important is to build that relationship with your supervisees so that they can come to the table bringing their strengths and their areas for growth. That's one of the beautiful parts about supervision, is that we're not expecting this to be a check the box, you're doing really well, let's get through it. It's more, let's talk about your strengths, your areas for growth, the things that you can do to better yourself and be healthy and well in all aspects of your life to bring your whole self to work every day.
Danny, can you advance to the next slide? Thank you, Elena. Yes, that's so like part of what is exciting about this work is, we have a lot of opportunities for employee assistance programs, and therapy is a wonderful resource for clients, but resiliency support is way more than that. It offers those three core functions. Next slide. And Elena, since this is really the core of your work, can you walk us through what these three functions are and how that manifests in supervision?
Yeah, so like I said, the first aspect is building that relationship where you're able to talk about some of the deeper things that happen with your work. A lot of times during supervision, you'll come in and you'll be talking about, so there's these terms called transference and countertransference. And that's where transference is where a client is seeing things in you, like that you might remind them of their aunt, or that you remind them of a trauma that they that had happened to them in the past. Countertransference is where the same thing can happen for us, the caregivers. And so I think that the restorative phase is just acknowledging that this level of care with the countertransference that can happen, it can trigger us to our own traumas or our own moral injuries, our own vicarious traumas from the past. It can bring those things up and make them really active and prohibitive, like a barrier to us being able to give our best care. So part of supervision, the point of that is to be able to help identify that. We can't always even personally identify when transference and countertransference are happening, but a skilled supervisor can typically help parse that out and help identify. Once you name it, I've found once you name it, it's easier to step away from it and be able to process it in a way that's useful in helping you continue your work with the provider, I'm sorry, with the client that you're serving. Normative is, this is where we're just supporting ethical practice through, or ethical, sorry, providing ethical guidance for the CBW. So this is more of a coaching role of the supervisor, where the supervisor is able to step in and utilize their years of experience. We're all trained in ethical decision making. That's part of our master's program, as well as a lot of what we're required to study after we graduate and after we get our licensing. We were required to have 6 hours every 2 years of specific training in this. So it's just basically to apply those ethical frameworks and models to the work that you're doing as the CBW, and to help round out that level of coaching that's needed, maybe to see things through a different ethical lens. I think sometimes when we're too close to the thing that we're doing or the person we're serving, it's hard sometimes to be able to parse out those dilemmas that might be happening, and having a skilled supervisor can really help with that. Formative is really similar to normative in the sense that it's a lot of coaching. It's focusing on learning and development, just really wanting to help them develop skills. It helps build confidence. It's like taking these processes of restorative and normative and making them into something applicable to actual boots on the ground work. It helps with taking some of these aspects of what you have maybe learned or parsed apart and applying them directly to the care that you're giving.
One of the things when you and I've had conversations, Elena, about what this could potentially become is just really around those three components of being able to help the community-based workers outside of their direct supervisor who's responsible for their workflow, have that safe place to unpack and explore things that they've learned, but they haven't been fully able to incorporate into their day-to-day work, which could be really intimidating to go to your boss or your supervisor and say, you know, all that training that I learned, I actually don't know what it looks like in my day-to-day job. That's really vulnerable and can put folks at the ability to have their work maybe questioned, but that is a sign of somebody who's really invested in making sure they know how to apply the skills that they're learning in a meaningful way. And to be able to have that external resiliency support, also known as clinical supervision, available to these workers gives them a space to truly deepen their professional practice and grow their professional skills, as well as set really healthy boundaries with their clients. And if you could, Elena, just maybe speak a little bit, especially as you've worked with clinicians over the years, and I think it's hard for us sometimes to think about that doing good can sometimes do harm, and what that looks like when you help clinicians and frontline workers and providers really figure out when their helping behaviors aren't helping the client move in their best interest.
Yeah, this goes back to one of the ways I think that happens, and is when countertransference comes in and we're not able to see the client objectively anymore, and we're kind of putting our own experiences onto the client. So I think that that's one thing that's really important in supervision, is being able to parse that out so that you can identify when that's happening, so that we're not unduly doing harm to a client. If we're not able to see the client objectively, it can cause some real issues. I think some of the other things that are impactful to clients is when we are spread too thin, when we're overpromising, which I've seen a lot of caregivers, and caregivers just typically have this heart to give and to do and to be of service for their clients. And sometimes that goes to the point of giving more than a provider has the ability to give. So I think that that's another thing that supervision really helps with, is identifying those boundaries so that we're able to give what we're able to give without giving more than we can give. That was a lot of gives in a sentence, but I think that when we overstretch ourselves, that really quickly can lead to burnout and compassion fatigue. And I think that when we're able to keep ourselves well and managing, compassion fatigue will happen to all of us to some degree. That's just part of the work. But it'll help keep it in check. It's like always kind of pouring a little bit of water off of a pot that's full of water. So it's somebody's dripping water in, that's the work we're doing. We're always kind of, we're in compassion, we're suffering alongside, but we have to have a way to pour a little bit of that water off from time to time so that we're not bubbling over. So supervision is one of the ways that we can pour that water off in a way that's really intentional. I think that having that clinical supervisor there that you know and trust, which Anna did a really good job a second ago of kind of talking about the fact that the relationship with the supervisor should be such that you're able to come in and really own some of the things maybe that you don't know or that you're worried about doing well with, or that you think you need more coaching on, and doing it in a way that it's private. No one gets to know what you talk about during your supervisions, and it's personalized to you. Your supervisor should get to know you as a human and know your strengths and your areas for growth. And so I think that these are ways that with that relationship with the supervisor, you can really start pouring off some of that extra stuff that's maybe lending itself towards burnout or compassion fatigue. So did I answer that, Anna? I feel like there was another section, but I didn't hit it.
Oh, no, that was fantastic. That was perfect. Yeah, as you were talking about just the challenges of being able to identify and the transference and counter transference, and how that having that place to really understand where we might be getting in the way of our clients and their goals. And I think also with resiliency support and clinical supervision, it helps us identify, am I holding on to this client because it's meeting my personal need and I'm actually hindering their progress? Or is there a level of dependency that we need to continue to work through, and now we need to revisit our goals so that we're moving that client toward wellness and not creating a codependent relationship as well? Because caregivers are drawn to this work because we get something from it. It gives us joy, it fills us, we've identified a skill set that really serves for the greater good. But when we don't have that ability to incorporate our training and our skills and have somebody kind of check us periodically to make sure that we are doing in the best interest of our clients, then it can go poorly for both the workers and the clients. And the other piece, Elena, that really stood out for me about what you said is the trust building component too, and overstretching ourselves, because so much of the challenges that our complex clients and patients struggle with is the revolving door of caregivers, because they get burnt out, because they succumb to compassion fatigue and moral injury, and they just can't do this anymore. And so not only is that detrimental to us as providers, but it also greatly impacts our ability to have long-term impact in the communities that we're trying to serve. Often when I was either in social work or even at the group home setting, I would come in, I would start building that relationship with my client, with my patient, trying to build that trust, build that rapport. And they would often say to me, what's the point? You're just going to be gone in 6 months like everybody else. And how are we able to move these complex needs forward to community wellness if our clients can't trust us because the workers are a revolving door? And so the goal of the resiliency support program is to make sure that we can maybe stop that revolving door and create pathways for professional development that also invite people and hopefully some clients into this workforce so that we can continue to grow and serve and meet the greater need, because the need is always going to be there. But if we can meet it more effectively and more efficiently, then we get to take care of more people, which is, I think, the goal that a lot of us have in this work, and build up our communities to make them stronger. Next slide, Danny. So, and Elena, do you want to add anything more to that before we head into the next part of this?
No, I think that that's a beautiful segue into what we're actually going to be doing. So go for it.
Okay, so what we are going to initiate this year at Greater Health Now with our workforce is we are going to provide resiliency support sessions for community-based workers and their supervisors. And we're going to have them meet in one-on-one sessions with a third-party licensed clinician and in a peer group. And we are separating the supervisors out of the CBW so that they can really have that more intentional space with their professional peers as well as the supervisors, because supervisors face unique needs and leading people with lived experience into this really difficult and challenging but crucial work to moving our communities forward. So we are looking at cohorts of about 30 to 35, and they will be receiving the support over the course of a year. And one of the great things that Anchor Point Counseling is able to provide, which we're really excited about, is that they have a provider that is bilingual in Spanish, which will support our Promotora network. And they have a provider who works specifically with first responders EMS to work with our mobile integrated health providers as well. Next slide. And so as we talked about before, the importance of resiliency support is to assist our workforce that's providing that complex care. And many of them have their own personal trauma that maybe they haven't been able to process and fully figure out how to incorporate that into their day-to-day life. And also a lot of the clients that they work with have very severe trauma experiences themselves, and they're incorporating and having that vicarious trauma experiences through the work that they're doing. And so by investing in our workers, we're providing personal and professional development that will really help us with workforce retention and quality client care. Next slide. So because this is kind of unique and we don't really know what this could potentially be, we thought, well, let's study this a little bit and see what we can learn from it. So we are dividing our groups into cohorts. We are going to have every person participating in the resiliency support sessions to complete the ProQual. It is a survey that measures the quality of caregiving for the individual, their self-satisfaction. It measures compassion fatigue, and it provides just a tool for helping understand where somebody is in their caregiving profession. So we're asking all of our participants who are going to be going through resiliency support to take the protocol now as they're going through their orientation. Many of them are participating in our Camden Coalition training certificate for understanding how to provide complex care. So we're pairing those to have them take the protocol before they do that training and before they start their resiliency support sessions. We've been very fortunate. We have a community partner who also provides complex care coordination in an adjacent region, not within the Greater Health Now region, who is really interested in trying to understand the benefits of potentially providing this type of service to complex care coordination service providers. And so she is working with her providers to also have them take the protocol right now to see where they are in their experiences. And then as we kind of move through this study, we'll ask them at the end of 6 months to also take the protocol. For our organization and group that will be receiving the services, 6 months in, we are going to have them retake the protocol. We're also going to administer a survey called the Manchester Clinical Supervision Survey midway between their services. This is an actual design tool to look at the impact of clinical supervision or resiliency support and how well it is actually improving the provider's ability to do their work and process their work. So our hope is at the end of this experience that we'll have not only a strong, healthy workforce that is really providing quality care, but a better understanding and an ability to explain why this is a true investment in the workforce and a really good return on investment for making sure that you're taking care of providers as well as providing high quality care in your community. Next slide. Elena, is there anything else you want to add? You and I first started having conversations about this at the advisory council when we got to sit next to each other at lunch. And I'm just super thrilled that Anchor Point is willing to kind of test these waters. This is kind of new territory for non-licensed clinicians to be engaged in this level of support. Do you mind just sharing like what sparked your interest and how you're willing to walk down this new road with us?
Yeah, I think that part of it is I believe in it so deeply. We've seen at our agency what it has done to be able to offer the supervision. All of our staff, we require that all of our staff get supervision at least once a month. Most people opt for once a week. That's how beneficial it is. People will come in and they'll usually spend a little bit of time talking about their cases and problem solving through cases. And then the rest of the time they'll spend kind of talking about their experience of serving. And so it's been something that I think has lent itself, we have very little turnover, and it's lent itself to being able to keep healthy, therapists on staff. I also think that generally what it has done, and it'll be interesting to see how it affects the people that we're going to be serving in this first cohort. It's made the workplace feel different in the sense that I think that we all know that we can rely on each other, and the support is there for each other. It'll be interesting to see if once we've bolstered some of the CBWs, their belief in themselves and their skill set, that if that won't translate over into some of those feelings at work as well. I think it's just, I've just seen there, like I said earlier, there's a reason supervision is required for our licensing. And I just believe in it so deeply, and I'm excited that we're going to be able to offer this in a new setting. And that we're going to be able to also have, one of the things I was very excited about is that we're going to have tools for measuring, hopefully, how well this is working, because I think that it's going to work well.
Yeah, I think that's what has me excited about this work too, is that it does impact not just your professional, but the culture of the organization you're working in. Having the luxury of working both in environments where I did receive clinical supervision because of the clients that I was working with, and in environments where that was not afforded to us, it wasn't deemed value. There is definitely a shared experience of that we're really all in this together. And one of the things that I'm also really excited about Greater Health Now's training and resiliency support program is we're offering this to a broader audience than just a couple of community workers that we're paying their FTEs for. This is something that we're providing to a broader scope of providers, because we really believe that if you have a trained workforce that is providing this really important direct client care, that also has the resiliency support and that clinical supervision component to really just not be better, but to be really skilled, trained professionals in this work, is really going to just elevate our ability to meet the needs of the community. So I'm really excited. And with you having valid tools to measure, are we moving this needle forward? It's one thing to believe that this is the right thing, but if we can articulate how it's effective, and to your point, that reduced turnover is huge. That is a huge return on investment for many organizations, in addition to just being able to provide wonderful professional support and development for their team. Other thoughts or comments or questions?
Anna, I would love to just comment. This is Manda. I also work with Greater Health Now, and I've been fortunate enough to be a partner on this project, and I'm very excited about it. And would love to just share from an HR perspective with my background, just how impactful this is. I've worked with many employee assistance plan benefits and that type of benefit, which is wonderful when employers are able to offer that. And but other than that, people have to pay for individualized expensive counseling at times if they don't have a support system for that. Also, sometimes those benefits are limited based on a specific issue. But to have a program like this that follows the individual, that we can track with a pilot study, is just fantastic, I think, from an HR perspective, knowing that we did deplete some of the workforce over the past few years. And touching on COVID, as you mentioned in the beginning of this presentation, we were at workforce shortages pre-COVID, and that only exacerbated it. So again, we've all felt those challenges, and we've seen the resiliency support language kind of picking up in other organizations. So we were really excited for that. We've seen some even state agencies use some of that term. So we hope that people are starting to think about this approach, however it might work for them in their own workplaces. So thank you for all this work and collaboration.
This is just such an incredible program, and we are so grateful at Greater Health Now to have the means to be able to support a program like this and to support our workforce. I'm curious if Anna, Amanda, Elena, if you have any takeaways from developing this program that might be applicable for someone who doesn't have the ability to develop something quite so robust, maybe a supervisor or program manager. Apologize, she is. Yeah, wondering, yeah, if you have any thoughts on what tangible action items from this resiliency support planning could translate over to that.
I think one thing that we had talked about in the past was the fact that EAPs and therapy outside of what you're able to maybe offer, if you're in a situation where you can't offer it in-house, resiliency support or clinical supervision, I think that it's important for the workforce to know that they can bring their work into those EAP sessions or into therapy, and vice versa. I think that also that you can bring your personal life and your personal maybe challenges into a resiliency support. So just like really encouraging staff to know that we don't necessarily, I know that oftentimes they'll say like leave your personal stuff at the door. You can only do that so far. We're humans and we're integrated. And I think that knowing that all of those parts can show up in clinical supervision, as well as if you're utilizing an EAP or something like that, to be able to broaden the scope of what you're able to talk about, because I do know this work is impactful, and just being able to bring that into maybe the services you can access if you're not able to do resiliency support, I think is important.
And in a previous conversation to Elena, you provided really great guidance for organizations as they're setting up their EAP programs to really have those EAP providers truly understand the nature of the work that their employees and their teams are conducting, so that they come in with a lens that can also help solicit some of that from the person who's receiving that EAP support and therapy support, so that it is more tailored and is able to really maybe get a little bit more quickly to some of the drivers and concerns that are being presented.
Absolutely. And I would add, if you don't have the formal benefit or you don't have a formal role of somebody performing these functions, how can you set up that space for people to have those conversations, one-on-one check-ins with their leader, debriefs after emotional events? Again, not everyone is comfortable, in a workplace setting, maybe going into their own personal life and how that might relate to them, that transference that Elena. So I think it's really respecting the workplace and maybe the boundaries that people may personally feel, but also not being afraid to have difficult conversations as long as you're being inclusive and respectful. So really looking at the team environment and how you can set that up within your team without a formal program or role with that. And I just am a huge proponent of EAP programs. They're underutilized. Put them to work for you. And actually, that is a wonderful segue as we, talk about the next topic, as really maximizing those EAP benefits as well that can help your workplace and provide those additional training resources, website resources, etc.
Also, can you speak a little bit to, I think it can be intimidating to facilitate those types of conversations in the workplace if you are not a professional clinician or therapist or even a professional facilitator, it can be scary to be having conversations where emotions or maybe different perspectives and opinions are being brought forward. Can you talk a little bit about crucial conversations?
Yes, we do offer some leadership training classes as part of our network. So we encourage everybody to look at that on our trainings and team development site. We have a few scheduled for the upcoming year, and we will be building that out more. But that is why at Greater Health Now, we really kind of believe in those skill development opportunities for leaders to impact their culture. We're looking at this from multiple levels. So recruitment and retention as an immediate need, but also how do we strengthen the culture of the workplace and provide the skills to be able to have those difficult conversations. Again, not going into things that people aren't trained or licensed to be able to facilitate, but just being able to open that door to make it a safe place. So we do offer crucial conversations training as part of our network. We have some of those on our website, but feel free to respond to our information email or here, and we'd love to get you connected to that if you feel like your workplace specifically right now could use some specific support and resources and tools on just how to handle difficult conversations, different topics at more of a general level.
Are there any last comments or questions from folks? Well, I really am so grateful for the time that we've had to talk about resiliency support and the programs and work that Greater Health Now is doing in this part of our waiver work. And really, really grateful to Elena and Anchor Point Counseling to dive into this with us and try the test in new waters and see what we learn and how we can make this better for our community and our team. So thank you. If you do have follow-up questions after this presentation, my contact information is on the next slide. I'm happy to follow up and answer any questions or connect you to resources that we have available. And thank you. Thank you all.
And this slide deck will be sent out following the collaborative in the next few days. So thank you so much, Anna, Elena, Amanda, for this phenomenal presentation. We are so grateful for your time and energy and for getting to learn about the wonderful resiliency support initiative that Greater Health Now is working on. So thank you very much. And with that, we will start to roll into our next presenter. And I believe I saw Darcy jump on. So Darcy, I'm gonna get rolling here.
Yeah, I'm here.
Okay,
Hey,
perfect.
hey,
All right,
Danny.
perfect. I'm gonna introduce you and then I'll turn it over to you to screen share. So Darcy is a licensed therapist and mental performance counselor with over 15 years of experience helping individuals navigate stress, mental health challenges, and performance pressures. With a background in both clinical mental health and sports psychology, Darcy specializes in supporting athletes, leaders, and high performers in building resilience and emotional intelligence. So with that, Darcy, would you like to start sharing your screen?
Yes, I will go ahead and share. Okay. Do you see like the full screen or do you see a smaller screen?
Yeah, we're seeing your speaker notes.
Oh, okay. Okay. Let me do the full one.
There we go. That's your whole
Okay.
screen.
Okay. Okay. Good morning, everybody. I hope everyone's doing well today. I don't know about you guys, but I'm in Seattle and we had a crazy storm last night. So where most of the city is without power. But I'm here today. So it's good to see everyone. My name again is Darcy Freeman, and today I'm going to be talking about strategies for addressing burnout. And so I'm going to go ahead and get started. So, okay. So what we're going to talk about today, I just wanted to go over that initially with everybody. I just want to, I know that there was a quick biography, little thing about me, but I just want to tell you, yeah, like I said, I'm located in Seattle. I am currently working in private practice, and before this position, I worked with an employee assistance program for quite a while. And so I don't know if people are super familiar with EAPs, but many organizations have EAPs, and through the EAP, you can access mental health resources. You can get like legal, financial support. They're quite an underutilized resource. So I always really like to remind people about EAPs because there's a lot of opportunities there to support yourself, to support family and the organization through EAPs. Before that, I did quite a long time in behavioral health management. I worked with youth and adults, all type of environments. So I'm excited to be here today to talk to everybody. If anyone has questions at any time, please feel free to raise your hand, interrupt me, write in the chat, anything that I can do to help clarify or add to this presentation. So after this, we're going to talk about why this topic is important, what it is. I know that in the previous presentation, there was discussion about alternative to burnout, that there can be some stigma around that term specifically. So we'll talk a little bit, on that. Thinking about what your personal warning signs are, and then what that stress cycle looks like. So the stress cycle is something that everyone goes through. And so what does yours look like, and where are the obstacles, and where can you find solutions there? And then after that, creating a supportive workplace. So moving more towards like the macro solutions, like the bigger look. And then lastly, just a little recap and some Q&A. So what is burnout? The World Health Organization definition of burnout, it says it's a syndrome resulting from chronic workplace stress that has not been successfully managed. So I don't know about you, but it's a pretty general definition for a word burnout. And I know that, with that term, there's like that thought of a flame burning out. And so then is it something that you can like reignite or like relight again? So the symptoms usually around burnout fall into like 3 different categories. There's like the physical, the emotional, and the behavioral. So when you're thinking about what burnout is for you, I'd like to just kind of like be somewhat reflective for these next few slides so that we can kind of understand what is going on for you in these situations, like within this stress cycle. So there's, the physical signs, are you feel like you're too tired, you're exhausted, you have headaches, trouble sleeping, do you feel like you don't have the motivation to do any like thing that moves your body, working out or just walking? What is that like for you? And when we're thinking about these symptoms, it starts with what your baseline is. So if your baseline is that you have headaches a lot or you have trouble sleeping, then that's maybe not something associated with burnout. It could be, but usually we're looking at what your baseline is and then when things start to look different. So what the changes are. And then in general, like within mental health, we're always thinking, what is your typical state? And then when we notice changes, that's when we want to be kind of like being more introspective and kind of identifying what is going on that feels different than what your normal is, right? So not everyone's normal is not the same. So that physical, you know, if you're all of a sudden feeling like feeling fatigued more than normal, or you can't sleep, you know, whether it's being able to fall asleep or waking up in the middle of the night and not being able to go back to sleep. And then there's the emotional symptoms that can be associated with burnout. That's, you know, irritability is a big one for people, you know, feeling like you don't have the patience that you might normally have. Feeling detached, like you just can't connect with people, you can't connect with family or friends, or just that feeling of overwhelm that, you know, you're like, I have so many things that I have to be doing and I just don't know where to start. And so that overwhelm a lot of times associated with just doing nothing, because it's just that feeling that you don't know, you have no idea like where to go in this situation, just feels like a huge thing looming over you. And then the behavioral aspect of it looks like decreased motivation. Maybe you're typically a social person at work and you're, you know, withdrawing, you're not really connecting with people. You used to want to eat lunch with people and you just like don't feel like doing that anymore. So again, I just really want to focus on things that start to feel different than your normal. And that's where we'll go with this. As I mentioned, that, you know, there's a lot of alternate terminology here and they mean different things. I don't mean to say that all these terms and burnout are all the same thing. They're, you know, they have different associations. So a lot of times there's, you know, a couple different burnout assessments that have been created. And a lot of times it looks like, you know, a continuum of burnout on one side and engagement on the other side. So then some people think that you're either burned out or you're engaged, when the fact of the matter is that you can be some of both, right? Like you can feel really engaged in some of your work and then burnt out on other parts of it. So there's it's not a very specific continuum where you're just one side or the other. There's just, it can be and or. So compassion fatigue, you know, that a lot of times comes from, you know, taking on other people's trauma, like witnessing or hearing about it and just kind of like holding that for somebody. The emotional exhaustion, you know, that can come from the similar situation like with trauma, working with people around that. It can also just come from like doing the same thing over and over again and just kind of like things start to feel more compounded. So if you are feeling like you're really tired of one aspect of your job and you have to do that over and over again, that can really create a lot of exhaustion, and potentially you might feel like disengaged. So that feeling of disengagement, especially when you're working with employees or clients or patients, that feeling of just being disengaged when you're in the room with someone can feel bad, essentially, you know, like, so you're wanting to be here with somebody, you're wanting to listen to them, to be a part of this with them, and they are just, you know, disengaged from the situation. Oh, can we do those polls? Okay. So I wanted to do a couple polls. I guess it has to be in Zoom, right? Oh yeah, there you go. Okay. So I wanted to do polls where the first one is, what signs of burnout do you see in your workplace? So if you could put in just like a couple words or just a single word of what burnout looks like in your workplace. So what you're seeing, whether it's, you know, within yourself or with people you're working with, what is that looking like? And then the second one is, you know, on a scale of 1 to 10, how engaged do you believe your workforce is? So what does that look like for you? And can everybody see the polls? It popped up for me. Just want to make sure. So yeah, if you could just take a minute or two to fill this in. And so then we can just kind of use this information as we're moving forward. So I'm guessing, Danny, it will show you the results of the poll?
You know, it's showing me the results of the 1 to 10. It's not showing me the open-ended results. I'm sorry
Okay.
about that. I thought that they would be popping up as well, but
That's okay.
I-
Yeah. I think it would be great if people were able to just like put something in the chat, or speak out and just like share kind of what they've seen with burnout. Then we can just kind of use that. Oh, the first poll didn't pop up. Overwhelmed and frustrated. Yeah, moral distress and moral injury. Longer supervisions. Tears, requests for mental health days. Yeah, big ask. Yeah. Personal burnout tracking and judging. Yeah. How difficult or easy was it to get out of bed in the morning? That's great. Like that is just an initial thing that you can kind of check in with yourself each day. I like that. Fatigue and irritability, people expressing that they are overwhelmed, emotional exhaustion. Yep, acting unlike themselves. Yeah, just noticing the difference in people. Numbness is one I didn't mention. Numbness is significant. Regular sleep patterns, increased sick time use, lack of motivation. Yeah, and I know that, I've heard from executives, that people shouldn't be using their sick time. So then there's also like, unless you're actually physically sick. So then there's like a stigma around that, like, am I allowed to use this time off? Is this mine? And what can I do during those times off? That's great. Okay. So Danny, does it show you would you mind sharing the results of the?
Yeah, for the how engaged do you believe your workforce is? We have a good spread between 3 and 10. Again, apologies for this dog. With 7 being the highest, so 9 people answered a 7. And then from there, between 3 and 10, there's 3 to 5 people answering those other 3, 4, 5, 6, 8, 9, and 10.
Okay, thank you. That's super helpful. So you can see that things look different from day to day, so how you answer those questions today might look different tomorrow. But ultimately, when we talk about, guilt for taking days off, exactly. Yeah. And so when we're thinking about, oh, this is yours. Okay, thanks. What does burnout look like, or how is it showing up in your workplace? Being aware of that and just kind of being like noticing and being reflective and understanding that it might change from day to day. Okay, thanks everybody for sharing. So I wanted to just touch on specifically why healthcare professionals are at risk. So I'm sure I don't have to be telling you this if you are working in the healthcare field right now, but it's a high stress environment. It always has been, but I think that in the last 5 years and even before that, there has been a different type of stress, and it has been a pretty massive stress on that environment in the healthcare field. So the patients have strong emotional demands. People really want engaged healthcare professionals. They want somebody who can be attentive to them all the time. It's a lot to ask, but it's also what if you've gotten into healthcare, like probably what you're hoping to provide. And so it can feel guilty or shameful if you feel like you're not able to be that engaged person every moment. And so people what I've heard from a lot of people in the healthcare field is just feeling like they can't be the person they want to be when they're, either supervising employees or in the room with a patient. There's also long hours and the work-life imbalance. This happens in other arenas as well, but in healthcare, there is a pressure to work long hours. So you don't necessarily feel like it's a choice. When they're telling you it's a choice, it can feel like it's not. That this is what's expected of me. This is what I am expected to do. And this is what it means to be good at my job or be dedicated. It means I have to work long hours. I have to commit more time to work than life. So another thing, when it comes to work-life balance or imbalance, is that it's not like a 50-50 scale, right? Like you don't just have to have half work, half life. Your personal work-life balance depends on who you are and what's important to you, what fills your cup, like how it can help you be engaged and committed when you're in both arenas. So, like if you like to spend more time at work, it doesn't mean there's anything wrong, right? Like that's what your work-life balance looks like. And if you like to be spending more time at home with friends or with family or by yourself, like that's your work-life balance. So there's no perfect way for that to kind of come up, but it's really about what's making you feel like you have the space to be yourself and to be committed and to actually be emotionally and physically engaged in whatever you're doing. And then the other part of this, and this is by no means all encompassing, but there's also systemic factors that play into it. I know like something that I talked about with Amanda and Danny is that there's a lot of federal money like being is part of like the healthcare field that we're working within, and so there's some threat of financial distress. There is kind of like what the amount of people that are coming into hospitals or healthcare, and just kind of being able to manage all the other factors that go into it, along with being good at your initial job. So there's like all these other layers of what's being asked of you. And you're expected to just kind of like show up and be available and be really good at your job. And to do that, a lot of times that people are expected to do that on their own, right? So not necessarily having the support that you need. So I wanted to talk about what your personal warning signs are. So if you just take a minute or two and think about and even write down what your 3 top signs of burnout are. And so again, I know like this term burnout doesn't feel right for everybody. So I just want you to kind of consider like what are the 3 things that you would notice that are different or not typical to how you usually function, and that may tip you off to like something's not feeling great, or I might need to give it more attention to something. So what are your top 3 signs? Yeah, and if you're comfortable putting it in the chat, I would love that. It's also okay if you're not comfortable with that. But yeah, all of our signs, our personal warning signs are different. So it's really nice just to kind of reflect on that for a minute and see what that feels like. Okay, yeah, I see how I see or react to people outside of work. That is a really important one too, because you're not necessarily in that environment anymore, but how are you feeling when you're seeing people that don't know what you're going through every day? And how are you reacting and kind of like engaged? Can you be engaged with a person that doesn't necessarily know what that feels like? Not excited to go to work, wanting to shut down after work is over, disengagement at work. Yeah. Yeah. So are you able to like go home and be with family or friends or by yourself and feel good about, like what you're doing? Organization in my workspace. I like that one. Like if you're somebody who is typically organized and all of a sudden you're noticing that things are kind of a huge mess, and feeling chaotic, I like that. Not wanting to talk with patients, lack of motivation, fatigue. Yep, feeling teary. Yeah, like almost like anything can make you cry, rolling your eyes, just like kind of like that, like cynical feeling. Weakened immune system is big. Yeah. Do you notice that you're getting sick way more often than normal? Especially now, there's just like a lot of different things going around. And are you able to kind of like fight these sicknesses off like you might typically do, or are you just kind of like succumbing to them? Decreased sleep, irritability and numbness, concentration. Yeah, concentration, like being able to focus in these moments can feel like a lot of work and someone's asking a lot of you. Overcompensating, feeling like I need to go back to therapy. Yeah. Yeah, just having someone to talk to. Craving alone time. Right. Trouble sleeping, headaches. Thanks everybody for sharing this. I know that this is personal, but it's helpful to just kind of like hear what's going on for other people so you can see like, oh yeah, that is something that actually affects me too. I don't even think about that. I mean, there's signs, like for me, when I notice that I'm really irritable, like I have two small children, and if I am like lacking patience, then I will start to notice that, okay, there's something going on here. Usually I have, well, more patience with a 4 and 6 year old than right now. But in those moments, you just kind of like maybe explode, or you're just like feeling really overwhelmed and you don't feel like you have space for whatever is happening in front of you. And then if you take a moment and step back and say like, okay, this is not my typical self, that's the perfect opportunity to kind of get back into this and see like what's going on. How can I like reset this cycle? Yeah, I think trouble sleeping is one of the biggest ones. And I know a lot of people have said that here. Your ability to like get good sleep is so important, and it's so significant for your emotional and physical health and your mental health. And so that's like one of the first things that takes a hit when you're feeling overwhelmed or exhausted or burnt out. So that's a really big one. And we're going to talk more about like how to manage this, how to start to like relight that flame, and just like this like bouncing back and resiliency part of it. Okay, so 10-15. Okay, so your body's stress cycle. I like this stress diagram because it helps to just kind of like appreciate what everyone is going through, right? So we start with the first one, the stressor appears, right? So whatever we're doing, there is a stressor, okay? And this is a the ideal stress cycle, right? This is how we would love for a stress cycle to work, because we're never going to be in a situation where there's no stressors. I mean, maybe if you're on like a really wonderful vacation, but otherwise, like when you're at work, when you're at home, there's always some type of stressor that can appear. So the stressor comes up, your stress response system is activated. So that's just like an automatic response that happens. And then the next step would be that your stressor is handled and disappears. Okay, so that's like an ideal situation. The other thing is that your stress response system is deactivated. Okay, so that's not automatic. Okay, so your stressor appears, you're automatically activated, but then you're able to handle the stressor, it goes away, and your stress response system that is something that you are actively have to actively deactivate. Yeah. So it's not automatic that this stress response system will just kind of like simmer and go away. So if you are aware of it, then you deactivate it, you move into the rest and recovery so that your system gets like to be able to calm down. You know, if you were up here, you're coming all the way down. Your like heart rate, like all like your brain is just kind of like calming. And then the last step is that the stress cycle completes. So this is like, again, an ideal situation for body's stress cycle. However, not most time, many times this is not how it goes because there's all these different spots in here where it could be interrupted. So, you know, if you have a stressor that appears, your stress response system is activated. Maybe you aren't able to handle the stressor, and so you just stay in that activation stage. When you're activated like that for long periods of time, it is really exhausting, and it's an exhaustion that you can't just like identify clearly. You'll just notice that you are real tired, real fatigued, teary, you know, all these things that you're talking about because your stress response system is working overtime because the stress hasn't been handled, or, you know, like let's say someone was mentioning feeling like you have someone's life in your hands and you're, you know, like you're trying to manage the situation for them and you're not able to. And then this is just like this activation is just kind of like on high alert. Or another situation would be that you're activated, you do handle the stressor, but you don't deactivate the stress response. So within your like brain and body, it's still thinking that you need to be on like high alert. Okay, because you haven't identified clearly that like the stressor is gone. So your brain is still thinking that it's something that you need to be activated for, and so it's like working on overtime, and there's not even a stressor that it's trying to handle. And that's a lot of time that's a time when you would probably feel a lot of overwhelm. So you would just feel like there's just this huge amount of thing for you to do. You don't even know where to start because there's nothing specific that your brain is attempting to problem solve. So it's just like this bigger, huge general thing. And then the next step, in step 5, the rest and recovery system is activated. That is where that's where the stress cycle can stop for many people. So there's like, that can be a huge interruption because if you get all the way through the stress cycle and you're deactivated and your brain and body wants to move into rest and recovery, then if you don't allow yourself to rest and recover, then you will stay at that like stress response, but it will just be down here instead of like this activation where you're like kind of like a higher heart rate. It'll be feeling like it's just kind of like existing in your body, and it'll start to impact you physically. So you're not allowing your brain to like come down off that high. It's like working overtime and is just continues to be activated. So again, this diagram here is the ideal body stress cycle. So if you notice that when you are dealing with a stressor, you've gone through, you know, like you're trying to manage it, you know, and then it's like the end of this stressor, or the end, you know, like where you have any control over it. And you notice that you're still feeling really alert, really activated, then you might kind of pay attention to like where you are in the stress cycle. That can be really helpful because if you're able to notice that you haven't completed one of these steps, then you will continue to be impacted by the stressor. So whether or not it's been handled or not, it'll still affect you. So the next thing I want to talk about is just what the rest looks like. Like, how can you give yourself that rest and relaxation so that you can continue to manage these stressors each day and that they won't continue to impact you, on a regular basis. So all of these 5 things are really important things for you. It doesn't mean that you need to prioritize every one of them. I would say look at this list and think about the 1 or 2 things that you actually feel like you can do, and that actually give you that like rejuvenation or re-energizing. So one thing is moving your body, whether or not that's exercise or just like going up and down stairs, going for a short walk. If you have a pet, taking your dog for a walk, whatever that looks like for you. Or maybe you're, like training for a marathon and you missed a day, of your runs. So how do you get back on track with moving your body or exercising? So whenever I look at these lists, what's helpful for me is I look at it and I think, again, what's possible? Like what would be typical for me in terms of moving my body or exercise? What are the obstacles that could come up in terms of like stopping me from achieving this? And then how do I manage those obstacles? So, for some people, let's say if you want to go on a walk in the morning, before work, there's a couple things that I could think of that can come up, right? What are some of the things that could happen, like some obstacles that could come up before if you're trying to exercise before or after work? Does anyone have kids? That can be trouble, right? Like trying to like do that with kids and managing that. If maybe you're a single parent or maybe you have a partner and working that out. The weather, yeah, the weather could definitely be an issue there. If you're planning on taking a walk and it doesn't, it's like pouring down rain or there's a windstorm. Yeah, not having time, feeling exhausted when you wake up. That's a tough one, right? So like it's super easy to just be like, okay, I am just too tired for this. Not enough hours in the day. Yeah, over peopled already. Yes, that makes sense. That's fair. Cost, right. Yeah, yeah. If you're wanting to go to a gym or do like a workout somewhere and it's like expensive and it's just cost of organizing. Yeah, right. It can be expensive. I mean, the gyms around me it's a commitment, like it's a financial commitment for sure. Not all of us live in a place where it's safe or accessible to walk around or run around, right? Like you might not live in a place that you're comfortable like going outside and it's still dark in the morning. So these are all the things like on this list. I just want you to think about what's possible for you, what makes sense, and then what are the obstacles that you can imagine. Okay, next one, prioritizing 7 to 9 hours of sleep. I know that that's much easier said than done for most people. There's a lot of things that could come up that could interrupt that sleep. So one thing I would say is if you're having trouble falling asleep at night, okay, so if you're somebody who you lie down and you just lie there for however long and it just can't go to sleep, start thinking about what your routine is before bed. What are the things that you normally do? And what's one thing that you can do differently? So an easy one is like, if you're looking at your phone, lying in bed, try not doing that, for 30 minutes before bedtime. And when you're lying there, that's kind of like an easy one to go for. But if you notice that you are just like lying in bed, can you have a journal next to your bed? Is there something that you could do to write and journal right before bedtime to help kind of like get the thoughts out of your brain and onto paper? Like if you're noticing that you're like ruminating on thoughts, or is there, like reading a book, not not like a Kindle or ebook, but reading a book with just like, a soft light on, so if there's trying one thing differently for your routine. And the same thing with if you notice that you wake up in the middle of the night and you can't go back to sleep, and that's like the problem that you have. What are you doing and what can you do differently? What's just one thing you can try? I certainly don't have the answers for each person, right? Like all we can do is try something different and see if it works. So the next one is spending time in nature each day. Is there anybody that can add in the chat like what you like to do in nature? So like what kind of activities you would do in like maybe it has to be sunny. Maybe winter's not like a great time for everybody to be in nature, but there's opportunities. So what are the kind of things that you like to do in nature that feel like re-energizing? Gardening, yeah. Going for a walk definitely counts. Yes. Mountain biking. Okay. Mountain biking is like a thrill. I like that. Yard work, oddly. Yes, thank you. Paddle boarding. Having a cup of coffee on the back deck. Oh, that sounds nice. Biking with family. Yeah. Doing something you enjoy for no reason other that you enjoy it. I thank you. Yes, I love that. Picking flowers in the woods. That sounds very romantic. I like that. Grounding, rock hunting, looking at nature, being present. Yeah. Thank you. Yeah. So, like, when you're out in nature, one of the things that I really like to do just as a mindfulness practice that's just real easy, I teach my kids to do this too because it's very simple, but just like a mindfulness practice that can help with like this rest and rejuvenation is just choosing one of your senses and really focusing on it when you're outside. So if you're just like, I want to only pay attention to the sounds I can hear right now, and you just like super focus on all the sounds. And so, I'll like be out there and thinking, oh, I hear a bird, oh, I hear car noises, oh, there's like a leaf blower, but it's like like slowing you down, grounding you, like your senses exist in the present, right? So like what you can hear only exists in the present right now. Like I kind of say like depression exists in the past, anxiety exists in the future, but if we're existing only in the present, then it's a really effective way to give our body and our mind just like a couple of moments to exist right now. Okay, the next one, daily deep breathing exercises. I know that this one might not be super helpful for everybody, but I really do recommend doing like even just 1 to 2 minute deep breathing exercises when you're feeling like you're in a elevated state and you really want to just like bring your heart rate down, bring your anxiety down, whatever it is that's making you feel, overwhelmed or burnout. These daily deep breathing exercises can be really useful. So oh gosh, sorry, I keep doing this. So the easiest is just, putting your feet on the floor, making sure your back is like up against something so that you feel like you're in a space that you can just kind of like be comfortable and relaxed. And then starting to breathe in and out your nose and just focusing as much as possible on the breath. So just like really noticing what it feels like going in and out of your nose, really just like appreciating the sounds, anything that's involved in that breath. And so in those situations, like when you have distracting thoughts that come in through your brain, this is a very non-judgmental moment, and we are not being harsh on ourselves at all. Like the focus is really on non-judgmentalness. So I don't think non-judgmentalness is a word, but being non-judgmental in those moments. So you're noticing that you have a distracting thought and you're just looking, kind of paying attention to it and saying, okay, there it is. And I'm going to like refocus on my breath. And so every time that happens, you know, I talk to people, I do a lot of mindfulness work with people all the time. And I just say, you know, just, you can look at that thought and say hello, and you can then just say goodbye and refocus. There's no judgment in those moments. It's really about just appreciating that you have the this opportunity to just take 2 minutes. I used to, when I was in meetings a lot more. I don't know if any of you are in a lot of meetings, but I used to practice like 2-minute deep breathing after every single meeting. And I would either close my computer if I was on a laptop, or I would turn away and just like not look at a screen. And I would just, you know, close my eyes and take 2 minutes. I would set a timer for 2 minutes and I would do that. And it was a really good break, a good transition between things, because sometimes it can feel like you're on meeting after meeting after meeting. And at the end of the day, you think like, what have I done today? So just kind of like breaking that up and just like taking moments can be really useful. So the last one, on a weekly basis, prioritize getting non-work social interactions. So whatever that looks like for you, and I know that's going to look way different for each person. It might be that you have family at home and that you're really prioritizing those interactions, so that when you get home, you have a routine that's your transition from work to home. Even more important if you work from home, right? Like, how do you separate that walking away from your desk, and then you have family or friends, and you want to be able to focus on them? And for most of us, we're not the same person at work as we are with family or friends, right? So like, how are you switching into that mode so that you can actually like appreciate the people that you're with, that you can actually interact with them and be engaged and listening and laugh, all the things that come with these interactions? Maybe it's that you make sure that you go to this weekly trivia, you know, that, or this weekly bingo night, you know, whatever it is that those non-work social interactions are. The impact of community and relationships has been studied a lot and is incredibly significant when it comes to taking care of your mind and body. So wherever it is that you find community, I know I was talking to someone last week. My community is AA, Alcoholics Anonymous. So that's important. This person's like, I've been sober for 20 years, and that's my community. And I make sure that I go to those meetings every week and just support other people on their journey. Like, whatever your social interactions are, just make sure that you find it. You identify like which ones feel good, which ones like fill your cup, and prioritize those each week. So is there people, if anyone would like to share like what your favorite non-work social interactions are, where do you really like to spend time outside of work and you feel like you're just like, it brings you joy or peace or whatever? Playing with my children, yeah. That's one that like a lot of people, you notice, like what I was saying before, you notice when you're disengaged, and it feels so much different when you just like take time to transition to that, and you just like choose to be present, and just kind of like, that feels so different than if you're just like with your kids playing on your phone, doing the thing that doesn't feel as good.
And it's hard. It's a lot of work to remember, or like just remember how to just play. Like, just play.
Yes, exactly.
Like, someone
Thank
had said
you.
that at a conference, like at a gathering recently, like, you just don't remember how to, like, some people do, but just to straight up just play and make a mess. And
Uh-huh. Yeah, making a mess can also be hard. You're like, oh no, I'm gonna have to like, how do you just let go and just just do it?
correct.
Yeah. Oh, going to the gym with my son, dinners with friends, spending time with family. Oh, roller derby. I like that. This is a great community. Board games and video games. I was just speaking to somebody who's has like a passion for those claw games at the arcades, and they like meet up with people and do the claw games together. Lego building. Oh, I love that. Yeah, these are all just like really important moments. And if it feels good, then it is helping you emotionally and physically. So these things that people are writing, like if you notice that, oh yeah, that is something that I used to like to do and I haven't been doing it, or just like pay attention. And is that something that you can reincorporate into it? Sitting in a dark and quiet space. Yeah. Yeah, I hear that. That's also very re-energizing. Yeah, as long as we're being deliberate and, making sure that this is something that feels good and that we feel like afterwards that we can be the best version of ourselves, like this is what we're looking for. Okay. So I would love to hear just from that list, what is one small change that you would like to try this week? And it's not necessarily that it's going to work for you, but what can you try this week? If you could share in chat, just like what's the one thing you would want to try that you're willing to do that seems like it could be effective for you?
Think if the wind stops blowing, we can go outside. We just don't want to fly away. It's like
Yeah, is it
ripping
really
here.
with it
It's
is
ripping.
okay.
My house is like shaking. I don't know about anybody
Okay.
else, but it's rough here.
Crazy.
Or get attacked by tumbleweeds.
Yeah, that's it. You got to go out. I'm thinking about Rob. Rob would do some fencing. We'll go out and get those tumbleweeds. Make like a concentrated game. Yeah.
Well, that still counts as my work.
Ah, well then you can, teach us or influence us.
That wouldn't count as your work.
Yeah. That would be fun learning for me.
And just to make it an acknowledgement from this still what I'm dealing with during this training, this talk, is that these are all really good things being presented, but it's still presented from an employer perspective to enhance my time at work and make me more productive. But with like all of these things, like what people do to like really relax and enjoy themselves and re-energize, you can't bike at work, you can't go to the woods and pick flowers at work, you can't paddleboard. And if I am dedicating 8 a.m. to 5 p.m. block of time for work, and my kids are done with the day by 8 p.m., that means that my work has 9 hours that I'm dedicating as a block to them. And then I have 3 hours that I'm dedicating as a block to my kids before they're just done and have to go to bed. And part of that is going to be making dinner to make sure that they have what they need to survive. So say I have 2 hours and now work is asking me to cut those 2 hours to do something to enhance my work. So part of this resiliency, this like all of this mental health stuff, it's like our if we're having this conversation at work, is work telling me what I need to be doing in my off time and telling me that I need to pull away from my personal responsibilities with my kids, which have a high priority to me? Or is there a conversation in the workplace with the employers of give 1 or 2 flex time hours for this resiliency? Go see Alana on the clock, something like this, because I can see the benefit of all of this stuff. Like even with the resiliency, I spent a year working at a casino, and most of the clients look different than me, spoke a different language than me. And my role in the casino was to take the money that they lost. So I was the enemy. And so outside of work, I started to see the people that, you know, looked different than me and spoke a different language than me as people who were trying to take advantage of me and who I needed to expect to be mean to me. So resiliency training in that job to help me not develop that bias to those people, which I needed to quit that job once I realized that I was developing that bias and then work on resiliency on my own to remove that bias. But still, like in our work, we're going to be interacting with people who have different situations than we have right now. And we're creatures of patterns. We're going to develop biases against that. And then, but to take like one of the 2 hours I have with my kids on a Wednesday to like, it's, I just don't see it being sustainable for me right now. I want it to be, but and that's just something that I haven't seen like engaged that I've been thinking about the whole way through. So sorry for like derailing and everything.
No.
No, that's very important. I appreciate that.
I do too. And for those who are going to be participating in the resiliency support, it is expected that that happens during your paid work time, that this is not something you have to take on after work. It's because this is such an essential part of your work that we're working with the organizations to build that into your workflow in addition to all the additional training. This shouldn't be something that you have to do outside of the work because this is the work.
Yeah, that is very crucial. I mean, everything that you said is real, and I'm sure a lot of people on this call are thinking the same thing. So I don't think you're alone on that. I think like it can be easy, like sitting over here and just saying like, here, try this thing. But I mean, like I would say the ultimate goal here in these kind of conversations is just like, is there something small that you could shift? Like, is there an opportunity that you haven't just kind of like seen clearly? Like, is there something you could do with your kids in those 2 hours that feel like, bringing you joy, or just like something small? And the answer might be right now, no. Like that could be the answer, is that I can't think of anything. But how can we like just like step back and look at where there could be opportunities for us? But I mean, I think can be really challenging to find that. I see a lot of people are commenting. Okay, yeah. So yeah, forming a book club with a few friends, that's awesome. I love that. That's something that you can, you're only meeting maybe once a month or once every 2 months. 15 minutes of yoga. Worth to make these changes for myself. Yeah. Social time, things for me, starting a journal, consistent exercise, getting into nature more, sleep. Someone please inform my toddlers. Yes. Having my staff build in duty free time to step away during their work hours. That's very cool. Okay. Walking in the neighborhood, book studies. Yep. Okay. I had a leader who did walking meetings outside for a monthly one. Yeah. Yeah, these are exactly. Okay. These are really useful things. And just like, again, what's one small change you could try this week? What's one thing that you could actually fit into your schedule that works with your schedule? So now I want to just move into, we have a little bit of time left. I just wanted to talk about more like organizational macro changes versus things that you're doing just for you, or that you can encourage, other employees to do. So what is like this, I just have this one slide where I just want to talk real quick about psychological safety in the workplace, because even like Rob being able to speak up and share that, there's hopefully he feels that there's a sense of safety, right? That he can share this information. And and that other people are identifying with the same feelings, right? So psychological safety looks like a place where you can speak up, you feel comfortable asking for help, sharing struggles, you don't feel like you're going to be consequenced or that, you know, people will judge you. So, you know, like, how are we in our organizations helping to create the psychological safety? And certainly, I know it can feel like, well, you know, that should be coming from above. Like, how am I doing this? But what are the small things that you can do that encompass this sense of safety? So whether it looks like encouraging open dialogue, you know, like, are you checking in with, you know, if you supervise a team, are you scheduling regular check-ins with them individually, and are you doing debriefs with the group? You know, so like, are you giving people opportunities to share and check in that otherwise, you know, they might be just kind of like keeping that to themselves? Is there a mentorship or buddy system, you know, that could be implemented in your workplace, on your team? Also normalizing taking breaks, using mental health resources. Something that I talked to people a lot about when I worked for the employee assistance program was they would talk to me about how they were planning to take a mental health day. And, you know, I would ask them, what are you doing on your mental health day? And they would say, oh, probably sleeping. So, well, is that a mental health day? You know, are you like, do you feel like you're taking care of your mental health? Are you feeling good after that? And say, no, I'm just like tired. Like, okay, so what can you do in those breaks? Like, how can you utilize those breaks more efficiently? Or how can you take those moments, take those days, and feel like you're actually able to make something happen that feels like, okay, I'm slightly more energized than I was yesterday. Also recognizing and validating your colleagues' efforts. Are you giving people credit where credit's due? Are you letting people know that you appreciate them? I mean, do you have, you know, like, whether you're supervising a team or you're part of a team, are you making sure that other people know that you're paying attention, that you are seeing what they're doing? And that culture of appreciation can go a really long way, because it'll just kind of like start to create like a bigger, more meaningful appreciation for each other. So when we look at like the bigger picture of workplace culture, again, I know that this is like, I can't just look at all you on this call and say like, this is your job and you need to like make these things happen. So what I want us to just kind of understand is, you know, is there anything that you feel like in the position that you're in that you have any control over, or that you can encourage your organization to do, or just like be aware of, you know, just even kind of like being attuned to what's going on in your workplace can be a way of making change. So, you know, is it a workplace wellness program? You know, how can you advocate for that? You know, do you have an employee assistance program? Is there other wellness programs? Do you know, does your workplace, you know, some of the workplaces give you access to the Calm app or other apps that are supposed to be like mindfulness apps, right? And just kind of like taking care of your mental and emotional space. Having conversations about mental health. Research has found that one of the most, or maybe the most impactful way of destigmatizing mental health, or giving people the courage to speak up about it, is just by people in the higher positions in organizations sharing their own personal experiences with mental health, whether it's something that they've dealt with on their own or a family or a friend, and just kind of letting people know that you're not alone, that this is something that a lot of people are managing through. And sometimes we know what we're doing and sometimes we have no idea. But just kind of like using each other as resources, like, where else can we find support? You know, you're spending a big part of your day at work. So how are you encouraging this culture of respect and appreciation and support? And then like the power of modeling self-care. So self-care, I have like kind of I don't love the word self-care just because it feels like it's almost lost meaning. But, how are you showing people in the workplace that it is a priority? Like taking care of your mind and your body, your emotional and behavioral and physical self, and your spiritual self as well. Like, how are you modeling that for other people? And especially, like for people higher up in organizations, that's a lot of times it feels like their ability to model that stuff can be incredibly impactful. So, how are you encouraging that, or how are you doing that yourself? So I'm not gonna do this because we're close on time, but just trying to think about what's one small change your team could implement today. And I don't know if you've noticed a pattern, but I tend to um I tend to encourage just thinking about just one thing you could do. What you could do on your team, or for, if you supervise a team or you're part of a team, or if it's just you feel like you're kind of like a siloed part of the organization, like what's one small change that could help with this greater culture of respect and support? What would feel good? What would feel useful? What would feel impactful? So, just a quick recap. Remember, if you can recognize burnout early, again, like that kind of that image of like a flame burning out, um, it doesn't mean that it can't be lit, right? Like, or it can't be just like still there. It's just that feeling of, like what are the changes that you are noticing that could be leading towards burnout, or compassion fatigue, or moral injury, or emotional exhaustion, any of those things. So what are those symptoms, and are you able to notice them? Also, implementing small but impactful changes. Again, just like one thing that you could do this week, one thing that your team could do. And again, this is like an experiment, right? So can we try this? Does it feel sustainable? Do I actually enjoy it? If not, I'm going to try something different next week. And then advocating for a healthier workplace. So if you feel like there's something missing, are there opportunities to encourage that? Are there opportunities to ask for something as part of your benefits? Maybe there is, maybe not. But how are you advocating, or how are you supporting wellness in the workplace? And yeah, I mean, my call to action here is just take care of yourself so you can take care of others. I think like we hear that a lot, but it is more true than we know. And if we don't feel well, then it's just incredibly hard to really be present and engaged with other people. So, oh, I like that. I calendar all my staff off one full weekday per month. That's a systems level. That's incredible. Yeah, that's a great way to support staff. So, yeah, if anyone has any other things to share in the chat, would love that. I think it's really helpful for us to see what other people are doing, or how other people are experiencing their workplace or their work. But otherwise, I'm happy to answer questions, and if there's anything that can come up.
Thank you so much, Darcy. I really appreciate your time, and what an engaging and interactive presentation. That's just phenomenal to hear from everyone, and get some insights into the things that you're doing or hoping to do for yourself and for your workplace. So we really, really appreciate that. Any other last minute questions for Darcy, or thoughts you'd like to share?
Thank you, everyone. I appreciate seeing all of you and being on this call with everyone.
Thank you so much. And thank you again to Anna and Elena for your presentation earlier. We really appreciate it. And thank you to all of you for attending. We do have a few housekeeping items before we jump off. We just wanted to share that we do have the topic of our next learning collaborative established, and the registration is now open. So join us in about a month to for on Tuesday, March 20th from 9 a.m. to 11 a.m., the growing role of the community health worker. So we have a dynamic lineup of speakers, and we are happy to welcome you all to that. I'm actually just realizing, I think it's actually Tuesday, March 25th. That's my typo, so apologies. It is almost exactly a month from today. So please feel free to use that QR code to register, or we'll include the registration link when we send the slides out following today. So you can also sign up that way. And we'll share more information about the topic. And finally, we just ask if you have a moment or two before you have to jump onto your next meeting to give us some feedback. We do have an open survey asking about today's experience, and then your request for any future topics. So if you want to take 2 minutes to complete that before you do your 2 minutes of breathing, I would really, really appreciate it. I'll also include the link for that in our in the follow-up email so that you can do it at a later time if that's more convenient for you. And with that, I think we'll conclude for the day. Thank you so much again to our presenters. Thank you for your attendance and your engagement. We really appreciate the robust dialogue and the chance to share. And we will see you in about a month for our next one.